Next, I want to introduce Dr. Michael Dillbeck from USA. He's a research professor and trustee of Maharishi University of Management, and his topic is about consciousness and collective health. Please share your wisdom with us.
Organizers, esteemed Vaidya's and guests, it's a pleasure to speak to you today about Vedic principles and research on consciousness and collective health. My essential point today is that the role of collective consciousness is an essential part of the Vedic concept of consciousness and Vedic concept of collective health found in Charak. And the ability to systematically raise collective consciousness to a higher level of perfection is the scientifically verified gift of Maharishi's Vedic science and technology. From the ancient Vedic records, we can read in Charak Samhita of the influence of the whole collective consciousness on health. Quote, "The root cause of all vata, pitta, and kapha is unrighteousness. That also arises from the misdeeds of previous life, but the source of both is intellectual error, or pragyaparad, such as when the heads of the country, city, guild, and community, having transgressed the virtuous path, deal unrighteously with the people, their officers and subordinates, then the people of the city and community and traders carry this unrighteousness farther. Thus, this unrighteousness by force makes the righteousness disappear." And then after describing an imbalance in nature that results from that, Charak continues, "Unrighteousness is the cause of the destruction of the community by weapons. Those who have excessively increased greed, anger, attachment, and conceit, disregarding the weak, attack each other or their enemies, or are attacked by their enemies, resulting in a loss of themselves, their kinsmen, and their enemies." So Maharishi has simply summarized all of this by saying that the accumulated influence of the violation of natural law by the members of society creates stress in the collective consciousness. And that's expressed in weakness and suffering, and if it builds up enough, can break out in large-scale calamities in society. The reverse side, from the positive perspective, is that the Vedic wisdom fortunately contains the principles and procedures to create coherence or sattva in society, thus transforming it in the direction of harmony and righteousness and balance. The key is the collective effect in society, allowing the whole society to be dealt with at once. So how is this possible? It's possible because the Vedic insight into natural law that nature is fundamentally unified at its most basic level. We heard about this in a very profound way from Dr. Hagelin yesterday, from the perspectives of both modern physics and Vedic science. And in Vedic terminology, this unified basis of existence is transcendental consciousness, or Atma, the inner self of everyone. A great revelation of Vedic knowledge is that Atma is universal. So the inner self of everyone is the same. My Atma and your Atma and everyone's Atma is the same. So Maharishi Mahesh Yogi brought to light the supreme practical value of this wisdom through his technology of consciousness, the Transcendental Meditation and TM-Sidhi program, and enabled its benefits to be verified on the collective level as well as the individual level. So the crucial element in this is that when the enlivenment of transcendental consciousness, or Atma, is strong enough by a group practicing the advanced technology of Maharishi's Vedic science, the Transcendental Meditation Siddhi program with yogic flying, then that everyone in society shares the benefits when the influence is strong enough. And a nourishing or balancing effect is being created in the inner self of everyone from that result. So how is that enlivenment of Atma made strong enough? Maharishi gave the principle that in order to create a measurable influence of coherence or sattva in society, what is needed is a group numbering only the square root of 1% of the society, who are practicing together the Transcendental Meditation and TM-Sidhi program with yogic flying twice a day. So this number of the square root of 1% is not a very large number, particularly when we apply the formula to whole societies. For example, of a city of 1 million people, the square root of 1% is 100 individuals in a group. And so for the almost 325 million people of the United States, the required group is 1,800. For the 1.27 billion people of India, the required group is almost 3,600. And for the whole world's present population of more than 7 billion, the square root of 1% is almost 8,600. So over the past 40 years, now research studies at the city and state and national and global levels have confirmed this effect of creating coherence in collective consciousness, which in the scientific literature is referred to as the Maharishi effect. And these studies have used the most rigorous methods available in the social sciences, such as time series analysis, and have been published in a variety of leading referee journals. These studies show that negative trends in society diminishing and positive trends increasing when the TM-Sidhi group is large enough. Now, these trends in society are related to public health in the broadest sense. For example, many studies have evaluated changes in crime, reduction of crime rate, which we can take as concrete evidence. Crime is a concrete behavioral indicator of the unrighteousness referred to by Charak Samhita. For example, in this study in Merseyside, England, Metropolitan Merseyside, the time series analysis showed that decreased crime rate started in March of 1988, which we see here on the right, when the number of group participants in the TM-Sidhi program in an adjacent community to Merseyside reached the square root of 1% of the whole metropolitan area. Before this time, before this threshold was reached, the Merseyside had the third highest crime rate of 11 major metropolitan areas in England and Wales. And after this time, in 1992, by the end of this particular study, it had the lowest crime rate. This study was conducted in Washington, D.C. in the summer of 1993, which Washington had quite an extraordinarily high murder rate at the time. And the leaders of the project, primarily Dr. Hegel on my left, predicted publicly at that time that a group of TM-Sidhi yogic flyers could reduce the rate by 20%, the reduction of violent crime. So they brought TM-Sidhi experts together on an 8-week course, and as the number increased of experts, the crime rate decreased, and here we see by the end of the project a reduction of about 23%. And other studies at the regional level show reduced conflict and even war, and at the global level, during the periods of the required global number being reached, 3 periods, the international conflict declined, as shown here, and also there was a reduction of international terrorism. But I'd like to just end by showing several studies at the national level that include more traditional health-related variables as outcomes. At Maharishi University of Management in the USA, the university and community members who are TM-Sidhi program participants have practiced together in the morning and evening since 1979. So during many periods in that time, the size of the group has been more than the square root of 1% of the US population. So in this time series analysis of the monthly data over 17 years, it was found that during and after months, when the size of the group of participants exceeded the square root of 1% of the population of the US, then there was a significant improvement in a comprehensive national quality of life index that comprised reduction of homicides, suicides, motor vehicle fatalities, deaths due to other accidents, notifiable diseases, alcohol consumption, and cigarette consumption, controlling for changes in national economic trends. And starting in late 2006, in order again to reach this required threshold for the US, a group of Maharishi Vedic pundits from India were brought to the Maharishi University of Management campus to also practice the TM-Sidhi program together with yogic flying twice a day, as well as to perform daily Rudrabhishek. So with the help of these Vedic pundits, as we see here, the size of the TM-Sidhi program group quickly reached the required number in January of 2007 and remained above the threshold almost all the time through 2010. Although these findings are just now being submitted to journals, I wanted to give you a sense of the holistic improvement in national life that resulted from this, particularly on health-related variables. Here on the right side of the chart, right side of the vertical line, we see reduced trend of violent crime rate in the major cities of the nation. Statistically very significant. Here we see the parallel reduction of national homicide rate for the whole country during that time. Here we see there is a very significant drop in motor vehicle fatality rate in the United States during that time. This is controlling for the number of miles driven. And here we see at the same time a reduction of infant mortality rate. Again, a universally acknowledged indicator of national health used around the world. And finally, we see here is the change of the reduced trend of deaths due to drugs. This is all types of drugs, including prescribed medical drugs. So remarkably, all of these achievements, all these changes in the United States collective consciousness started simultaneously in January of 2007 when the size of the group reached the critical threshold. So by creating such groups in educational institutions around the world, where a large number of students are gathered already, and where they also will enjoy the individual benefits of beginning the Transcendental Meditation program and TM-Sidhi program, then a fresh wave of collective health can be created from the most basic level of nature, the unified level of nature, the level of Atma, the self of everyone. And so for this very precious knowledge, we give thanks to Maharishi and the timeless tradition of Vedic masters. Thank you so much.